Good morning, everybody. Pleasingly, New South Wales has passed the 45% of full vaccination. So technically we're at 45.6 of our 16 and overs being fully vaccinated, and of course it's when that milestone hits 70% that we're able to have those freedoms that we currently don't enjoy. Pleasingly also, 78% of 16-year-olds and over have at least one dose, and as we've said previously, we're really keen to see that first dose number be as high as possible before we open up, to give us that extra level of coverage and safety. To 8 p.m. last night, there were 1,262 cases of community transmission, and regrettably 7 people lost their lives, and we extend our deepest condolences to the loved ones of all those who've lost their lives. Again, we know that once someone has signed up for their first dose of the vaccine, the second one is guaranteed, and so Dr. Chan and I have said consistently we really want to see that first dose go up as much as possible. So if you know anybody in your circle of family or friends who hasn't been vaccinated, please encourage them to do so. The sooner we have that coverage, the more confidence we'll have in what we can do moving forward into the future. As Dr. Chant will highlight, there has been some stabilisation in local government areas of concern, which is pleasing. However, the most concerning areas where the virus is picking up pace at the moment are in a couple of suburbs in southwestern Sydney, which Dr. Chant will outline, as well as some suburbs in the inner Sydney and inner western areas. Whilst we can look forward to having a much better life, much better freedoms at 70% double dose, we can't afford to let our guard down. We can't afford to not keep doing what we've been doing, because otherwise we will see too many cases when we open up at 70% double dose, and that's not what we want to see. We want to make sure that when we get to that 70% double dose figure, that we've managed to reduce our cases as much as we can to allow us to continue planning forward. And I'm personally very looking forward to when we get to 80% double dose and beyond, and that's up to all of us. So please encourage anyone in your circle who hasn't yet been vaccinated to come forward and get the vaccine. I'll now hand over to Dr. Chant for her daily update, and then we'll take questions. Thank you.
There were 1,262 locally acquired cases of COVID reported in New South Wales to 24 hours to 8 p.m. last night. There were no overseas cases. There were 105,505 COVID tests, so thank you to everyone who's come forward for that testing. There are currently 1,206 cases, COVID cases, admitted to hospital, with 220 people in intensive care, 92 of whom require ventilation. Now, when we talk about those in ICU and the proportion that are vaccinated and non-vaccinated, it really is to emphasise the fact that we are in a very privileged position, that we have access to very effective vaccines and we know they work. And I just urge everyone in the community to come forward to their first dose and then follow that up by their second dose promptly. In terms of, sadly, the deaths, we've seen 7 deaths of people with COVID, a man in his 20s from Western Sydney, a woman in her 40s from southwestern Sydney, a woman in her 50s from southwestern Sydney, a man in his 50s from Western Sydney, a man in his 70s from southwestern Sydney, a man in his 80s from southwestern Sydney, and a woman in her 80s from southwestern Sydney. I just want to extend my deep sympathies to those families. Every time we read out a death, it is really the fact that that death reverberates through that family and the extended community. When we talk about the fact that people are dying, whether they're vaccinated or have underlying health conditions, it really is to highlight the fact that there are still many people in the community who are elderly and not vaccinated, who have underlying health conditions. However, I just want to make the point that whilst you're likely to have more severe COVID if you're older and have underlying health conditions, even previously healthy people of all ages can get severe disease and die. So please do not be at all complacent. Go online now and book an appointment and get vaccinated as soon as possible. We have very good vaccines available in Australia, and we need to use these vaccines to protect us. I want to see 80% first dose next week, and I'm confident we'll get there around Tuesday or Wednesday. And then my challenge to the New South Wales community is let's get to 90% the following week. And let's also work across our most disadvantaged communities to make sure that no one is left behind as we strive to have the most equitable distribution of vaccine of any country in the world. And that's my aspiration. Thank you. I would also just like to highlight some suburbs of concern. Whilst we've had a strong focus on those communities in southwestern Sydney and western Sydney, we are seeing some little signs of hope of stabilisation of the case numbers in those communities. We are, in turn, seeing increases in cases outside those local government areas of concern. So in areas like Glebe and Camperdown, Redfern, Waterloo, we also are seeing some activity, high activity in places like Punchbowl and Wiley Park that are in the areas of concern. My message is please come forward to get tested and vaccination. Redfern Community Centre is a new COVID testing site and it's open 7 days a week from 10 a.m. to 4 p.m. And as part of our mobile vaccination program, we've got free Pfizer vaccines are now available at various locations including West's at Ashfield Leagues, Green Square Library at Zetland, the Morris Yemma Indoor Sports Centre at Riverwood, and Club Burwood and the National Centre for Indigenous Education at Redfern. So we're really very grateful to those people who have come forward for testing. That helps us block those chains of transmission. Please come forward for vaccination as well as we try and dampen down and suppress any transmission in those local government areas. But across the state, you need to be vigilant. We cannot be complacent anywhere. We are seeing also case numbers increase in Central Coast and Illawarra. In terms of our sewage surveillance, we've been detected fragments of the virus in Moruya, Port Macquarie, Trangie, Young, Brookland, Jiroa, Eden, Yass and Karua, Tamworth, Dunbogan and Dungog treatment plants. I'm particularly concerned by Yass, where we're seeing an increase in the level of the sewage detection. And so can I ask everyone, particularly in Yass, to come out for testing with the most minimal of symptoms and please follow all the public health advice. Thank you.
Dr. Say is other man in his 20s who's died doing anything with regards to vaccination status, underlying health conditions. That's quite young to die from COVID.
That gentleman actually had significant underlying health conditions and was unvaccinated. But again, I just really want to make sure that when we're articulating this, we're doing this for the purposes of communicating to the public. This is no comment on individuals and whether they've had access to the vaccine or whether those things. So I don't want to make it about those individuals, but for transparency, I think it's really important that we provide that information. But as I said, please go out and get vaccines. Vaccines have become much more available. Pharmacists have got access to vaccines. GPs have got access to vaccines in our state-run clinics. It is critical that everyone supports everyone to get a vaccine. And I've urged people before to reach out to your friends and family if they need a little bit of extra support, driving them to the vaccination clinic, helping them navigate a booking. Please do that. It is so critical that we mitigate any impact of COVID through our vaccination programs.
Just on Glebe, Waterloo, Redfern, Camperdown, I know there's a building that's shut down in Camperdown. Are we seeing cases there in vulnerable communities in those suburbs?
That's correct. What we're seeing is COVID has so effectively sought out vulnerabilities. And that's why it's not about our overall vaccination coverage. It's also about how effectively we've engaged to people that are in challenging circumstances, be they're homeless, be they people in social housing, be they the people that are affected by drug and alcohol and mental health issues, and be they other members of the community that are living in large households and under difficult circumstances. It is so critical, and Australia's healthcare system has been one of the most equitable in the world, and the challenge for us is to do all we can to make sure that our vaccine coverage is incredibly high in those groups. And I want to acknowledge the hard work that our local health districts have been putting in place, and a lot of local government organisations, local councils, the Aboriginal community controlled. There is a lot of work that we probably haven't talked enough about in how we are trying to reach and all of those vulnerable communities. For instance, there's been vaccination programs for our homeless that have been running for many, many months. But obviously there is turnover in those communities, and it is important that we redouble our efforts in order to protect the most vulnerable in our community.
Dr. Chant, we're planning on reopening within weeks. Are you comfortable that those vulnerable groups that you're talking about, enough of those are going to be vaccinated on the current rate that they're at? Enough of those people are going to be vaccinated to make up a good proportion of the 70% target that we're seeking?
So by the time we get to 70% target, I'm hoping that we have done a lot of that hard work. I'm also clear that the community has shown, when I look at the data, it's pleasing to see that the uptake amongst all age groups is actually increasing. And when you think of it, our younger age cohorts haven't had access to the vaccine for that long, relatively speaking. And it is so pleasing to see that we are seeing that uptake. And I do not have, I suppose I'm being a bit optimistic, but I think we actually can get to that 90% first dose. I'm pleased that we've got the 12 to 15-year-old vaccination coming on, as announced by the Commonwealth on Monday. So that group will have access to vaccination. And I'm also pleased that we're doing such strong programs in partnership with a variety of people to make sure we target our most vulnerable.
With the 12 to 15-year-olds coming online, they're not included in the target of 80% or 70%, 80%, double dose vaccination for people over 16. So do you think that with 12 to 15-year-olds now coming online, that could slow down our trajectory to 70% over 16s, or is the cohort too small?
Look, this is all a factor of vaccine supply, and I'm confident that as soon as the vaccine becomes available, and the Commonwealth has announced that there'll be more Moderna through pharmacies, that they're increasing Pfizer allocation to GPs and bringing on more general practice. I suspect there will be increases in vaccine supply, and we know that the vaccine supply situation becomes very improved as we go through every week to week. And so I'm optimistic that as New South Wales residents have embraced other vaccines for adolescents, they will embrace vaccination for the 12 to 15-year-olds.
Just asking about the modelling though. Sorry, I'm just asking about the modelling though. I mean, if 12 to 15-year-olds are using or taking up space in the vaccination system, will that slow down over 16s getting vaccinated because you've got all these 12 to 15-year-olds in
Clearly my advice to general practice is prioritise your most vulnerable. So if you've got bookings available, I would very much urge GPs to vaccinate the 40-year-old with underlying health conditions. However, as vaccine becomes more available, we do not want to waste any vaccine dose. There are multiple avenues for entry, and we actually want to get vaccines into arms, so as quickly as possible. And can I just thank the pharmacists and thank the general practitioners. If you look at our data, it's been amazing. Pharmacists are continuing to give around 9,000 doses of vaccine every day. That varies a little bit and it's lower on the weekends, but our GPs have also been incredibly stellar, giving in the order of 70 to 80,000 doses a day. That is amazing. And so people need to continue to reach out. The vaccine supply situation will change, and that's why I'm urging people to just keep open all their options. And but please, another message, cancel your booking if you've managed to secure supply ahead, because obviously I don't want to see any vaccines wasted, and we don't want GPs where there's do not attends just because you've managed to get a vaccine somewhere else.
Dr. Chan, we previously were told that this coming week, modelling showed that this coming week would be the peak in cases and mid-October would be the peak in hospitalisations. Given, as you mentioned, we've had those slight stabilisations, is that still what we're tracking towards? Are you still expecting the peak in cases in the coming week and hospitalisations mid-October?
I'm still hoping that we peak, but to some extent those projections depend on how effectively we can control the spread outside the local government areas of concern. And as I said, our response is what we can do in terms of setting and establishing the public health orders, but it is also very much in the hands of the community in terms of how they're responding, industry, how they're responding, and how we work across the community to support us getting through this critical phase. And I know I've used that language many, many times, but we have the opportunity to increase rapidly our vaccine coverage, which helps us, but we also need the community to be following the public health advice and the orders at this time. That will give us the greatest hope.
Dr. Chan, as it starts to warm up, obviously that's going to be helping the situation as well. We've got new rules coming in for people tomorrow. We've still got a month or so to go before we reach that 70% target. Are you likely to recommend for areas that have low case numbers and high vaccination rates further easing in some areas like mask wearing outside and things like that? Are we likely to see any more rules change between now and that 70% mark?
Look, at the moment, I'm focused on seeing a sustained decline. At the moment, we've got too many bushfires going. I've indicated a number of areas where I've got concerns about the fact that we've got cases increasing in Central Coast, Wollongong. I'm very confident that those local health districts will work in partnership with a variety of people to do all they can to suppress those case numbers. But as we know, we need to work very hard, and the community needs to stay with us if we are going to see this sort of go into the situation of reopening at a time when we have lower case numbers as possible and the highest vaccination coverage as we can. And we have the opportunity to get there.
Sorry, Dr. Chan, just to clarify on vulnerable groups, do you have an income bracket breakdown of the vaccine rollout, and what does that show?
So I think one of the probably easiest things to do is go to the New South Wales, Service New South Wales website, which has got the interactive suburbs on that, and you can look at the vaccination coverage by suburbs. And I'd actually ask all members of the community to go onto those websites, and you'll see that the level, the work that's being done to actually raise that first dose vaccination coverage has been amazing. And that is a reflection because we know that many of the suburbs in those local government areas would have lower socioeconomic profiles. But what we also need to know is that even in high socioeconomic areas, there is still vulnerability, and we need to be open to that. So even in the most affluent of areas, you will often find pockets of disadvantage. And I'm confident with our primary care system, with our local health districts, with our partners across the NGO sector, that we can do all we can over the coming weeks to identify those pockets of disadvantage and make sure that individuals have access to vaccination.
You said that we're seeing rising cases in areas that we haven't had before outside of those LGS concerns. You're only hopeful that we're approaching the peak, but you don't know for sure. Are you at all concerned from a health perspective that scrapping regular daily press conferences from the most senior levels of government will send the impression to the broader community that we are past the worst of it?
I think that we will. I'm committed to engaging with the community and speaking honestly and frankly about my assessment and that of the government. So I think we'll look at a variety of different ways, but clearly it is important that we continue to provide information to the community in a transparent way, and I'll participate in those processes.
Dr. Chant, today Coogee, Maroubra beaches are already heaving. When you see those pictures, how do you feel?
I think we've got to temper. I mean, I do ask everyone to just stay with us, and for me also, I realise that many people in who are living in southwestern Sydney and Western Sydney don't have access to that because of the restrictions. So for me, that causes me some concern, because clearly I'm asking a lot of the people of southwestern Sydney and Western Sydney. However, we do have to understand, and I haven't seen those pictures, so I don't know whether people are maintaining social distancing, but in reality, outdoor environments, if people are keeping away from each other, are probably the safest environments. I would like to see that people are really respectful and that they are adhering to the public health orders as they move about, if they're walking along the beach. But I would not want crowds, people engaging, people socialising. That is not what we need at this moment. We do not need people to be breaking the public health orders, as we don't want many more spot fires. What we want to do is extinguish as many spot fires as we have, and I don't want to be having to put an additional burden on our public health resources in responding to outbreaks in those areas.
I was there yesterday. About 99% of people weren't wearing masks, sitting down everywhere together. So it's not happening. Balmoral, Manly. So it's
Sorry, what was the question?
Just your thoughts on the scenes on the beaches yesterday.
As Dr. Chant and I have said, the next couple of months will be the most challenging for us. We know that people are tired after the enormous things we've been asking of them, but we must stay the course. So I say to everybody, please don't start getting complacent now. We know the weather adds to our positivity and what we can look forward to in October. But it's so important we all stay the course and just hang in there, because we know, as I've said, as Dr. Chant has said, the next few months are the most challenging. We're obviously going to see a peak in cases at some stage, and we're also going to see a spike in hospitalisation or a peak in hospitalisation during that period. And what is most important is that until we have a safe coverage of double-dose vaccination, we can't let down our guard. And that's why, as much as we'd love to be able to think about things that we can offer people between now and then, we have to take a very safe and cautious approach so that we don't risk any unnecessary further stress on our already stressed health system.
Some parents have expressed concern that some pubs will be open before certain year groups of schools will be able to go back to classrooms. What do you say to that?
My response is, I know that all school communities and parents want us to make sure we've planned for a safe return to school, and that's exactly what we've done. We know that obviously what gives children the best support during the pandemic is high rates of vaccination amongst the adult population. We factored that into the equation, as well as what is a safe way to return children to school. So obviously, for me always, getting kids to school has been a priority, but Delta has thrown a few spanners into the works in terms of what we do. So I appreciate people raising that issue, but the reality is what we must do is have a certain and safe return to school. And every week that goes by, we're seeing increasing rates of vaccination, whether it's first dose or second dose in the adult population. And that gives us extra protection, because we know that as soon as schools go back, that means adults will congregate at particular times, dropping children off or picking them up. So there's a lot of risks associated with school going back beyond the school gate. And they're all the things we've needed to consider, and that is why we've taken the approach we have. But as alongside that approach is, whenever it's safe to do so, we will give people those freedoms, and I hope the roadmap demonstrates that. It's a balanced and safe and cautious approach, and I know there'll be lots of commentary leading up to that time, but what will give Dr. Chant and I, and she can obviously speak for herself on this matter, that the greater assurance is having increasing rates of that first dose going to our adults, as well as seeing a good proportion of 12 to 15-year-olds vaccinated before we get to that time.
Federal Labor's calling for mandatory vaccination of teachers. And while I'm on the school subject, what about Year 12 students? Can we guarantee them positions at uni, at TAFE, or help to get a job?
Sure. Well, firstly, New South Wales, we've already said teachers must be vaccinated before they teach in the classroom. So New South Wales has already gone down that approach, as well as early childhood providers. So we've already made that decision. What was the second question? I'm sorry.
Guarantees for Year 12 students.
Oh, of course,
been smashed the last 2 years.
Yeah.
In terms of a position at uni, position at TAFE,
Yeah.
or help to get a job.
Yeah. Look, we've been liaising closely, when I say we, the Education Department and Health have been liaising closely with the tertiary sector to make sure that no student is disadvantaged. We've actually ensured that we've communicated the later timetables for when marks will be made available and when students can be assessed as to entry. But remember, a lot of universities these days offer pre-admission as well. So we've consulted the tertiary sector, and Victorian students went through this last year, and I suspect Victorian students and New South Wales students will be in the same boat. We represent 60% of Australia, so we're grateful that the tertiary sector, whether it's universities or TAFE, have really come on board to support the timetable that we've put out. We would not have put out the timetable had we not had confidence that the university sector and the TAFE sector was supporting our decision.
Kids in Western New South Wales, particularly Indigenous populations and other people with disadvantage in Western New South Wales, seem to be falling through the cracks due to COVID, learning remotely, especially in areas where there's COVID. What specifically are you doing to help these kids in Western New South Wales, or Indigenous kids in country New South Wales, or anyone that is falling through the cracks in a more remote area of the state?
Well, obviously, depending on where children live, there are options for remote learning, whether it's providing technology, providing that additional service. So the Education Department learned a lot of lessons last year when we asked parents to home learn and homeschool their children, or teachers rather.
Is there anything additional you're doing for those kids that you're not doing for kids in Sydney?
Obviously, we make sure that all vulnerable children across the state are taken care of, COVID or not, but especially during COVID. And as you know, for students in Western and Southwestern Sydney, who we know would be required to sit for public examinations, some weeks ago we ensured that they were offered the opportunity to get vaccinated, all the HSC students, and we're encouraged to hear that other students outside those areas are also choosing to get vaccinated. So our return to school is safe and cautious, and obviously, whilst children are asked to be home learning, whilst teachers are asked to teach students remotely, that the Education Department and the Education Minister would have ample information on how that's done. But I remember last year the New South Wales Government invested in a lot of additional technology, a lot of additional equipment, so that students who were disadvantaged actually had that at home if their parents weren't able to afford to purchase it for them.
Premier, just some clarification around the rules tomorrow. Is it still exercising in groups of 2, considering that there's groups of 5 that can... what is it about exercise?
Obviously, this has been made public for some time now, but in local government areas of concern, it remains you exercise within your household or with one other person, so 2 maximum. However, in areas outside of local government area of concern, 5 people are able to come together, 5 adults, and that excludes children under 12.
If I could ask you the same question to Dr. Chance, and I know you spoke about this at length on Friday, but do you have at all a concern that the lack of this setup, which lots of people in the public tune into, is going to send that impression that we've reached a turning point in the pandemic that we haven't reached yet? And what other interactive modes of health communication are you looking at? Because a video posted with the numbers doesn't give people who are confused at all the chance to ask questions of the government.
Of course, but we never said that we would change this format every day. Quite the contrary, we will provide information that is best for the community. And I was very upfront and honest to say that whilst there will be ample information provided on a daily basis, I won't necessarily be the one providing that information on a daily basis. And that's because, as I've said, I need a clear head. The next 2 months will be the most challenging our state has seen perhaps ever. And I need to make sure we are not only making decisions for the next day, but for the next weeks and the next months. And it's really important to make sure all of government is prepared for what the next few months bring us. And I'll still be a regular feature at 11 a.m, but not every day. And I was very upfront about that. And I'd rather be upfront and tell people than them saying, where is the Premier today or tomorrow? Because I need to make sure that government gets back to its usual processes as quickly as possible. Just as the community will start to reopen, government has to get back used to not running in crisis, but getting used to running and living with COVID. So government itself has to prepare for living with COVID and not just crisis managing every day. So please be assured that I will be a regular feature. That might please some people and that may not please some people. I'll still be regularly attending 11 a.m s, but not every day. And I just wanted to make that clear. Because we need to make sure that all the decisions we're making moving forward, because our state will be the first state to make these decisions. Our state's the first one to outline a roadmap in living with COVID. We'll be the first ones outlining when international travel resumes. We'll be the first ones changing our quarantine system on a large scale. There's a lot of firsts New South Wales will be required to do, and I need to make sure that we're making those decisions in a proper way with all the resources of government.
You've been asked to provide evidence to the ICAC in coming weeks.
Look, as I said, I don't have anything to add on that matter. It would be appropriate to comment on ongoing investigations. I've been very consistent on that and I have nothing further to say.
Premier, we're not asking you to comment on the investigation. We're asking whether you've been called to give evidence at private hearings. So that's a yes/no?
No, as I said, it's inappropriate to comment on any ongoing matters, yes or no. And that's always been the proper way to respond to those questions.
Is the reason we are going to be seeing you less at the 11 a.m. conferences because you have been called to appear?
Oh gosh. Gosh, I wish you could all be privy to the conversations we had about the ongoing 11 a.m. press conferences. This is all about making sure that we provide good government to the people of New South Wales, and the Premier of the state should front to the people when she needs to make sure people know when there's a major milestone or a major issue, or when I feel I need to be accountable. Some days that could be 7 days a week. Some weeks it could be 3 times a week. It depends on what's going on. I just wanted to give people notice that as we're facing the next few challenging months, from time to time, I will be doing obviously matters of state in governing the state as I should as the leader. And so I think people understand that. I think people understand that I need to make decisions that are best interests of the state, and I think people would also trust that I would exercise good judgment as to when I should front, as opposed to other people providing that information.
Premier. An issue in you yourself being the one who decides when you will be accountable for something or not. How will people know whether there is something that they need to ask or they need to know about, or that you need to answer to, if you're the one deciding, yes, today I can be accountable, no, tomorrow I won't, particularly with Parliament not sitting?
Oh, I think that they're obvious questions, and I have a good team, and if it's a relevant minister outlining information instead of me for a particular day, I think that's completely acceptable.
Premier, if someone is a person of interest to
Last question, please.
Independent Commission Against Corruption, can they still sit in cabinet in your view, or is there no room for anyone in your cabinet?
Oh, look, I've made my position on those matters very clear in the past, and I don't have anything new to add.
Is your position, Premier, is your position?
If you or anybody, any of your ministers are named as a person of interest in private hearings or they're subject to investigation, do you think that information should be made public?
Oh, look, I'm not going to venture into hypotheticals, and I maintain the same response I provided previously.
Australians getting home for Christmas.
I'm sorry?
Australians getting home for Christmas. You've been quite strong on that. Is there any progress on that? People are very focused on that right now.
Oh, absolutely. That's my intention, not only that families are reunited by increasing international entrance through Sydney Airport, but I would also hope by that stage that internal borders are gone in Australia. And it's only a matter of time before Delta becomes a part of every state's experience. I mean, Western Australia is obviously a much more remote state than other states, as is Tasmania. But I would like to think that by Christmas, not only are we welcoming home more Australians, thousands every week from overseas to reunite for Christmas, but also that we don't have these internal state borders that we have. And I predict that New South Wales and Victoria will work more closely about these matters moving forward. And if you look at the way, the things have been tracking, there's no doubt that Victoria and New South Wales will be in very similar positions in relation to being able to welcome home Australians, and also in relation to how we live with COVID, and it's really important to remember.
Premier, sorry, just to clarify.
Sorry, one more, sorry.
Looks like Moderna, by the way, is going to the states that gave us their vaccinations. Are you okay with that?
Oh, look, I will do what I've done from the beginning, and that's fight for more vaccine. We know, and again, I hope people remember what criticism I attracted when I said vaccine was the way out of this. Vaccine is how we live with Delta, and that remains our strong position. Yes, of course we need the restrictions and the lockdowns, but in terms of how you live with Delta, the restrictions and the lockdowns are there until we get high rates of vaccination, and until we get those high rates of vaccination, we won't truly be living with Delta. And I will continue to argue for more vaccine. I will continue to lobby for more supply, because as I said, we've noticed a slight dipping in the rate of vaccination. It's partly due to supply and partly due to people waiting for their second dose. And of course, for us, we have a sense of urgency about how many jabs we get in arms.
I'll just clarify, Premier, noting that John Zede resigned from the front bench when an investigation into him was announced. If someone is under investigation by the ICAC, can they remain in cabinet or not?
Nothing has changed in relation to that matter.
Do you
believe that the public has a right to know if their Premier or a member of her cabinet is before ICAC?
Well, they are matters for the Integrity Agency, absolutely.
Thank you.
Thanks, everybody.